Great question. I have two sets of tips. Number one is about struggling with the prereq. If you're struggling with prerequisite courses, the first and most important thing to do, because you're going to need it no matter which field you choose, is to learn how to study effectively. I recommend prioritizing active study methods, including practice questions. That's number one. Practice questions are the best. Or other things like writing practice questions once you get a bit more experience. One of the things I found really helpful was learning how to synthesize all of the information in these difficult courses and then presenting it in small study groups and then larger study sessions to my colleagues when I was an undergrad. Experiment, try different things, and it'll pay off in the long term because everyone studies just a little bit differently, but most everyone will do better when these study methods are active. Now let's talk about whether PharmD or MD. Very different job. I have known pharmacists who have pretty patient-facing roles, but more often the pharmacists I've known work with the so for example in the ICU they may round with the physicians and the nurses and everyone and be consulted on complex drug-drug interact. The folks I have found who do better in pharmacy really like the technical aspect and the thinking and the reasoning and having a broad extensive knowledge base. I feel that my job is a bit different as an MD in that there are people who have roles that are less patient-facing, particularly in administration or research or that type of thing. But I feel like the core passion for an MD has to be that role with the doctor-patient relationship. Diagnosis, treatment, communication, education, complex decision making too, but I'm never ever going to go toe to toe with a pharmacist when it comes to talking about med mechanisms. If you want to learn more about which one is the right fit for you, it's a great idea to start talking with people. Talk with pharmacists and talk with medical doctors and start to get a sense of what makes sense. As you're talking to them, you might be able to arrange some opportunities to shadow them or interview them about their experiences. The more you expose yourself to people doing the work you think you might want to do, the more opportunities you'll have to feel that sense of, oh, this is what I want to do, and you'll kind of go further in those directions and it'll help guide you. Hope that helps.